When people come to see me, they often ask me about, well, what's the overall plan? What would keep me young looking? What's the best recipe for anti-aging of the face? And it is a combination of things. Combinations are key. I always say that combinations are key. We've got to think of different factors that cause the aging in the first place. Like, first I would look at is overactive muscles in the glabella, the forehead, around the eyes, and also particularly the platysma. We have to treat those because those are the muscles that are really contributing towards the aging process. So of course we use the muscle relaxing injections in there into those areas, and we don't go overboard with that. But I think it's also, as I keep saying, it's also very important that the platysma muscle in the neck is treated, because that overactive platysma, and we've shown different examples of that on Instagram before, that really pulls the face down and really ages the neck. So I think it's vital to inject small amounts of muscle relaxing injections into those bands and into the overactive platysma, also to the depressor anguli oris here at the corner of the mouth, and a little bit into the mentalis, that's the chin muscle. So once we have that done, we then got to look at, well, what other things are contributing towards aging, and volume loss is a big thing, but the key is not to overinflate. So to put in small amounts of hyaluronic acids or Radiesse or Sculptra into the areas to lift or to fill. So that would include small amounts into the cheek. Again, I have to emphasize that this is small amounts, not the overfilled, the crazy overfilled cheek syndrome that none of us want. Then out here into the lateral face, we like to use a little bit of hyaluronic acid. We can also use Sculptra is a great product to lift and to elevate the temple, to elevate the lateral face. We then have to look at the perioral area. Now, not the lips. We don't want to start filling the lips. That's not the way to go. The overfilled lips, the overfilled cheeks, we don't want that. We want to put in little bits of Restylane product in around the nasolabial, in around the marionettes. That really can give a nice result. So they'd be the key areas to do. Then once we have those done, and we have our biostimulators, our Sculptras, our Radiesses, once we have those done, we then need to look at the surface of the skin, because their surface of the skin ages in different ways. So that can be down to genetics, that can be down to smoking, it can be down to too much sunbed. So we do have to avoid sun on the face, particularly on warm summer days, because a lot of damage can be done. I don't think anybody using sunbeds is not a good idea, particularly not a good idea to let the light from the sunbed go onto your face, because that's going to really eat up the collagen and make you look old and wrinkled before your time. We look at those factors and then we think of how are we going to improve that. Initially, we can do some skin boosters. That could be Restylane skin boosters, it could be Profilo. We are also using now our needleless injector to get the products right into the dermis where it really is needed. So we really need to get into the dermis with those kind of products to get the result. Then on top of that, we like to use laser, the Cyton laser. We can use the BBL for inducing production of collagen. So we get great production of collagen from using the BBL laser. After they've had a couple of sessions on the BBL, we notice that there is a huge increase in their collagen and they really get a glow. We use the newer one, the BBL Heroic, which is more powerful and is really great at treating brown spots, red veins, but also particularly for the induction of collagen. If you look at that on the Cyton website, you'll see that there is this Forever Young protocol where people do sessions of it, a few sessions, and then maybe keep that up with 1 or 2 sessions per year. And we look at, there's a famous doctor, Dr. Patrick Bitter, who's been doing Cyton BBL procedures on himself for years, and he looks much younger than his actual age. Other things then we can combine with that, we also use the profractional. That's where we drill these little microscopic holes into the skin to get the collagen forming, and we get great results of that. Now you can do BBL and then stack the profractional on top of it to really get a boosted result. So that works out really well for resurfacing and improving the texture and the surface of the skin. With the BBL Heroic, we can also use different modules on it, and that is the procedure called Skin Tight, which actually helps to tighten the skin, and we have another one called Skin Smooth, which smoothens the complexion and the texture of the skin. So these can all be stacked, the base pass of the BBL, and on top of that we can do the Skin Smooth and the Skin Tight, and then the Profractional. So they're all can be combined. As I keep saying, combinations are key. We do also like to use some products. We like to use some Obagi products, which can also help with things like they have the 0.025%, 0.05% tretinones, which we use it at night. Now it is a strong product. We'd only use that initially twice a week, and then you can gradually increase the application. So your resurfacing lasers, your BBL, your Profractional, even your contour TRL, where we even go take away the full 100% surface of the skin. That's for people with more severe lines. But these combinations are incredible for keeping you young looking. You don't need to go crazy with surgery. They look natural. That's the key thing. They look natural. We see too many bad examples of people who look unnatural, but if you follow these key steps and do small amounts, you end up with a very natural look.